All right. Good morning. Welcome to Health Talk with Dr. Mutiat. I apologize for the lateness today. I woke up early and decided to tackle some chores, and time got away from me and I couldn't get back in time. So good morning. Welcome. Thank you for joining me. Thank you. Thank you for giving me the opportunity to teach you, to speak. And thank you for the opportunity to learn from me. So it is a pleasure to be here. Before we get started, I'd just like to, say a little spiel. Please understand this is not an end all be all. This is not a substitute for your doctor's care. Whatever you learn from me today, it's for informational purposes only. Should I say anything that resonates with you, please check with your own primary doctor, your care provider, before you embark on anything I talk about today. All right, before you embark on anything today. So today we are going to be discussing endometriosis. It is Women's Month, and keeping in theme with Women's Month, I will be discussing things that pertain to women this month. Last week, we had a discussion. I forgot what I forgot. This week, we are going to discuss endometriosis. All right. I know a lot of you have, heard endometriosis. You've heard about it. But you don't know what it is, and you've just heard, oh, it's painful, you don't know what it is. And that's what we're going to discuss on this topic. So you leave you a little more enlightened. And if someone ever tells you they have endometriosis, you offer your support, and, you just, be with them, offer yourself as much as you can. All right. So before we get started, my name is Dr. Sunshine, Dr. Mutiat. I am a board certified adult nurse practitioner, with almost 20 years in practice. All right. So did you know that, endometriosis, like I discussed, affects 1 in 10 women? So every 10 women you meet, one of them has endometriosis. That's pretty much how common it is. And it takes, because it is so not studied. It is, and I always say this, or I've always said it to people, like medicine, when medicine was being studied, it was mostly studied on men, not women. So a lot of things that affect women, we don't know. We are learning as we go. I know, you'll be like, all these years that medicine has been in practice, how do we not know? A lot of things were not studied on women. So it takes a long time for women to get proper diagnosis of what's going on with them, about 7 to 10 years, if possible, because all the symptoms present with almost similar diseases that you think, oh, maybe it's this, maybe it's that, because there's no specific test per se. You can draw blood and be like, oh, you have endometriosis. There's nothing like that. So it's just a more of, like, for lack of a better word, trial and error. So a lot of women go through this and they don't know what's wrong with them. And whenever they go visit their doctors, if they go visit their doctors, they sometimes come back with not having answers, and there's more testing and testing. So it takes about 7 to 10 years to get, a proper diagnosis of endometriosis. All right. So endometriosis, I'll define it to you. It is a chronic condition. Keyword is chronic condition. When something is happening consistently for more than 3 months, it becomes chronic. Acute is if it happens for less than 3 months. This, for women that suffer endometriosis, it is a lifelong issue. So it's a chronic. It is always going to happen. Hello, Miss Ogbu. Thank you for joining me. It is always going to happen, and there's no if, buts, or ands about it. So it's a chronic condition where tissue similar to the lining of your uterus grows outside the uterus, and it's painful. Remember, tissue that lines the uterus grows outside the uterus. And if anything, that's, for women, we go through a uterine shedding, which is like your period, like when it thickens and it sheds. That's that lining. That same tissue happens wherever it is. It can cause inflammation, it can cause pain, it can cause scarring. All these things are painful, very, very painful to the woman going through it. So if you've ever met a woman going through severe pain during their period, don't be like, Shabi, my mom always had a period, or Shabi, my sister had a period, Shabi, this person had their period. How come you're the only one that you're rolling on the floor? It happens. Shut your mouth. Offer them, what you can do. Offer yourself, what can you do for them to help relieve their pain? All right. So not every woman's period is the same. There are some women blessed. My mother is blessed with painless periods. She told me she never had painful period in her life. Her daughter, who she bore, painful periods, though mine is not severe. It is not endometriosis. I have dysmenorrhea is a standard for me. All right. So where does it occur? It can go in the lining of uterus, can go in your ovaries, It's not supposed to be in your ovaries. It can be in your fallopian tube. It's not supposed to be in your fallopian tube. It can be outside your uterus. There's the inside of uterus, outside of uterus. It can be outside of uterus. It's not supposed to be there. It can be in your bladder. It could be in your intestines. And I have personally seen someone that the lining of the uterus was in their lungs. This was about 10 years ago, over 10 years ago. We're in 2025 now, so that'll be 215. No, before that, a long time ago, there was this young lady that I knew that every month she would have issues with the lung, difficulty breathing, all that good stuff. And we were, what's it? After a while that the doctors actually went into the lungs to find what's causing bleeding in her lungs, we found out that it was tissues from a uterus that's in her lung. So when she's having a period, she's bleeding in the lungs because the tissue is shedding the same thing in the lungs. Yeah, I know. It's weird, but it happens. It does. So, all right. So now, like I've explained to you this, but I'm going to ask this question. Why do you think endometriosis is misdiagnosed, or underdiagnosed, or ignored? Why do you think endometriosis is underdiagnosed, misdiagnosed, or ignored? Think about it. Let's participate. Let's do this together. Answer in the question. Answer in the comments, and I'll read it, and we'll talk about it. All right. So, what are the common symptoms? All right. What are the common symptoms of endometriosis? Pelvic pain. Pain. And when I talk pain, I mean pain. These women are in severe pain. These are the women that are rolling on the floor when their period is coming. These are the women that cannot get out of the bed when they have their periods. They have severe pain. Severe pain that regular Motrin, regular ibuprofen, regular any of you may not be able to handle. These women need strong pain medication during their periods. All right. Severe pelvic pain. Painful periods, pain when having sex, pain when having sex. I believe we're all adults and I'll discuss sex. Pain when having sex. All right. Pain when moving your bowels or when peeing. Pain. And now this pain is not a pain of a UTI. It's not a pain of a urinary tract infection. No, trust me. These women can distinguish. They can distinguish that pain. So pain when moving their bowels or moving their urine. And this often happens when their period is about to start. When your period, all this pain, all the symptoms, like you're noticing pain that occurs with you when your period is about to start. Pain in weird places that you're like, why am I having pain here? Have it checked out. I know to ladies that found yes, it can get, yes, Mr. Honor, it can get bad. It can get bad. It can get terrible for those women that go through this kind of pain. All right. Infertility. Actually, that's when most women receive the diagnosis of endometriosis, because most women or some women think, pain in period is a norm. Pain during your period is not the norm. It is not normal to have painful periods. All right. If you have painful periods, you need to go to your doctor. They need to check you out and find out what's causing pain. Oh, Miss Juliet, thank you. This topic is a while. I appreciate you. Thank you. And the funny thing is, I almost did not want to do today because I'm feeling discouraged. And I feel like nobody listens, nobody watches. So what's the point? I'm just wasting my energy. I almost did not do today because when I got caught up with my chores, I was just going to ignore them. Like, nobody watches anyway. So they won't even know that I'm here. So please encourage me. I always ask this. Please encourage me. Don't think I'm doing this. I need the encouragement. So let's go back to what we were talking about. All right. Infertility. This is when most women receive the diagnosis of endometriosis. This is one, because when they're trying to have babies and they cannot have babies, and then they go see fertility specialists. If you go to a reproductive endocrinologist, remember, I told you there are different doctors that do different things. A reproductive endocrinologist is the person that can handle infertility, and they go and they start running all these tests. It will come out that this person has endometriosis. So infertility is one of the big reasons why women actually find out that they have endometriosis. All right. So during their period, some women have fatigue. Yes, I know every woman has fatigue, but their fatigue is extra pronounced, extra diarrhea. These women cannot leave the house because they will poop their pants. All right. They will have, some of them may have constipation. Some of them, they have bloating. Some of them have nausea. Yes, I know these periods. Remember, I said endometriosis is difficult to diagnose. Now you see all the symptoms that I'm listing. Doesn't sound like it's the usual. But what makes it worse for other women is it's difficult. My cousin, and it's yes, Miss Ogle. Yes, this is what they see. So please, if you know anybody suffering, please make sure, they go see a gynecologist. A gynecologist is a doctor that handles, girl parts, for lack of a better word. And if they're trying to have children, they need to go see a reproductive endocrinologist. So all these things, and yes, we have them in Nigeria. Yes, we have reproductive endocrinologists in Nigeria. So please make sure they see the right doctor. You just don't go see an internal medicine doctor, a regular doctor. They won't know what to do with you. So I've had women come to me, Muti, I went to see a doctor. They did tests. Oh yeah, what test did they do? And then they bring me CBC CMP. I'm like, what is this? Why are you doing CBC CMP? This is not the problem. This is not what we need to do. A regular medical doctor will just do a basic test. They will not diagnose you. You need to go see the right doctor for what's ailing you. In this situation, this topic we're talking today, as a woman, you need to make sure you're seeing your gynecologist. You need to see your gynecologist every year. And also, if you're having problems with infertility, you need to see a reproductive endocrinologist. So 2 different doctors you need to see. All right. Okay. So let me see. Are we here? Do we have any questions? Okay. Now, I have my true or false questions. You always know I'll throw a true or false questions to you. All right. Myths. I'm going to discuss some myths and some facts. All right. Severe period pain is normal. I've already talked to you about that. Is that true? Is that false? Severe period pain is normal. Is that true or false? All right. Endometriosis only affects the reproductive system. If you were here in the beginning, you can answer this. Endometriosis only affects the reproductive system. Oh yeah. Do we have an answer to them? True or false? True or false? I'm listening. Do we have any questions? All right, Miss Loretta, thank you so much. Thank you. Good. All right. Severe pain is not normal. It is not normal. Okay. Severe pain is not normal. All right. And endometriosis, thank you, Miss Maureen. Thank you for participating. Endometriosis does not only affect the reproductive system. Remember, I talked about my young lady that had it in her lungs. Miss Titi, thank you for joining. Thank you. Yes, the answer is false. It is not. Now, what causes endometriosis? What causes endometriosis? We don't really know. Remember when I said earlier, all right, that women's body were not really studied when we were studying medicine. They were not. It was male body that was studied. So we're still learning what causes endometriosis. But here are some possible causes, causes. We have what we call retrograde menstruation. Retrograde menstruation. This is when instead of when your uterine lining, when they shed, you will go out. For some people, it comes back in. Does that make sense? Are you understanding it? You are supposed to, pass it. It comes out through your vagina. You'll go all that. No. For some women, it doesn't go out. It just sticks to the pelvic walls. It doesn't come out and it backs up. Like there's a flow. Imagine you open a tap. Instead of tap to run the water straight down. No, it's coming back up. That's not what's supposed to happen. All right. All right. So also some hormones in your body, and your immune factors, sometimes they do something that they transform or what's the word I'm looking for? They change your cells into something else. And then they change, let's say this cell, everybody, the body grows, your stem cells and all that grows. Like, let's say this cell is designated to be a uterine cells. But when it's in the process of forming, it changes some hormones, some immune system, some area where you live changes that cell and turns it, instead of the one that goes to urine, turns it that goes to the lungs, turn it to the one that goes to the stomach, turns it to the one that goes to anywhere else in the body. When it's supposed to be the cell, when it was growing, the body's like, this cell, you are going to go to the uterus. But something changes in your body that turns it from the one that's supposed to go to uterus to the one that goes to your stomach. The ones that's supposed to go to uterus, that goes to your lung. Things like that can happen. All right. Another thing is, I've talked about it. It's pretty much embryonic cell changes. I've kind of explained it in transformed cells. All right. All right. Sometimes when a woman has had C-section, in the process of cutting, the scar tissue and some cells may attach itself into the stomach area. That one causes the one that goes in the stomach. They have to cut a lot of places to get to your uterus. So in the process, some cells may migrate out and go to where they're not supposed to be. that may cause endometriosis. All right. Immune system, if you have some immune issues, yes, a lot of people don't know they have immune issues. They don't know until something happens, then they will know that they have immune issues. I don't know, but I used to have serious pain during menstruation until I had my first one and it stopped. Okay. You're one of those. There's some women that they do say that it's after you have your first child, your period pain stops. It's the norm for them. As long as you've gone to your doctor, they've checked you out and make sure there's nothing, we're good. You're good. All right. Okay. So what are the risk factors that raises your risk for endometriosis? If you've never had a child, if you've never given birth, can increase your risk of having endometriosis. Can it also be caused by physical factors? It may. That's why I said, like, sometimes it could be like, it depends on where you live. If it's like a high chemical area and stuff like that, and it enters your body in some weird ways, it could be. When you say physical factors, are you open? Like, you thinking something like obesity or stuff like that? Because obesity has not been linked to it. Like, what do you try to break it down for me? So, all right. So when another thing that can increase your risk of endometriosis is starting your period at an early age. Some young girls start their periods at age 8, age 9, age 10. Starting your period at an early age may increase your risk for developing endometriosis. All right. When you go through menopause at a later age. Like I said, when we talked about menopause, remember we talked about that average age of a woman going through menopause is 51. Some women go longer. They might be 60, 65 before they hit menopause. Each body is different. Okay. All right. When you have heavy menstrual period that lasts more than 7 days, it may increase your risk for endometriosis. All right. When you have low body mass index, you're tiny, it may increase. Maybe that's what Ms. Ogu is talking about. If you have a small body, that may increase your risk for endometriosis, food and the rest. So right now we've not seen food increasing your risk for endometriosis. No, it has been studied. All right. Now, if you have a family member, an aunt, a mother, a grandmother, and remember, I've always talked about this. Look at your family history. See what's happening in your blood relatives. And there's a good chance it may happen to you. If you've noticed your mom, your aunt, your cousin that's a woman, that's older than you, your grandmother, somebody has had very, very painful period or have had endometriosis, good chance you may have it. All right. So any health condition that prevents the blood flow from flowing out of your body during your period can risk endometriosis, can increase your risk of endometriosis. So, endometriosis can happen years after you've had your period, and it may get better after you've had children, or you may get pregnant after pregnancy. So please, know your body. Nobody knows your body better than you. I can give a general symptom. I can give a general overview, but each body is different, and how you present and how your body is. You need to know your body and know what's the norm for you. I know what's the norm for me, Mutiat. I don't know what's the norm for my sister. She needs to understand her own body and know if something is wrong, she can follow up with her doctor. Now, what are the complications of endometriosis? Infertility. Remember, I talked about it. It's one of the reasons why women go to the doctors. All right. Endometriosis can lead to infertility. All right. Another thing, it can cause cancer. It can risk ovarian cancer. If you have endometriosis, it's been linked to cause ovarian cancer. All right. How is endometriosis diagnosed? That's the question. How is it diagnosed? Remember, I said there's no blood system per se that will tell you, oh, you have endometriosis. It's number one, we can do a pelvic exam. When you go to your doctor, they'll do a pelvic exam to see how your body is, to see how your pelvic floor lining is. Sometimes they may not be able to see anything because the lesions are too small to detect. Then they can send you for ultrasound or an MRI based on what they want to see. But then you can show cysts, but it's not often effective. I know the most effective way of diagnosis endometriosis is what we call laparoscopy, where your doctor actually goes in with a camera. It's a surgery. They go in with a camera and look at your cavity and see the lesions and see if it's there. So that is the way we confirm that you have endometriosis. All right. Why is diagnosis delayed? Remember, I asked you this earlier, because the symptoms mimic other diseases. Like, you remember when I talked about you may have constipation, you may have diarrhea. That mimics irritable bowel syndrome. All right. The pain may mimic ovarian cyst. You don't know as a provider when your patients give you these symptoms. There's no diagnosis. There's no thing that says this is what's causing this. Like this is a hallmark sign. We don't have that. It's mostly a lot of trial and error. And we say, okay, come back and this week. When we tell you to come back, we want to see, okay, what we do, did it make sense? Did you get a cure, for lack of a better word? Was it managed? When we ask you to come back, we want you to come back. It's not because we can't give you that one diagnosis immediately. It doesn't mean, oh, that doctor doesn't know what they're doing and just jump from one doctor to another. They're going to do the same thing if they're a reputable doctor. You are going to start again from scratch because you have to put one foot in front of the other. You have to put one foot. Remember, I said it takes about 7 to 10 years to get actual diagnosis of this because we have to try one thing after the other. There's no one thing that says, oh, this is what causes this. There's none. All right. So you have to put one foot another or in front of the other. You have to make sure you follow up with your doctor when they say, come back. Come back. All right. So how do we treat it? I normally don't talk about treatment, but this is what I'm going to make an exception for this is number one, we need to manage the pain. If you're a woman going through this, you need to go see a doctor so they can place you on appropriate pain medication. You can go on appropriate pain. Yes, Miss Joyful Noise, it is painful. I have to, yes, Miss Joyful, it is very, very painful, severely painful. Not only very painful, severely. I know you've heard of women that cannot get out of bed during their period. They are in severe pain. Endometriosis can be like that they can't get out of bed or do anything they need to do. Because they are just in bed. The fatigue is so extensive they can't get up. The pain is so extensive they can't get up. They can't do anything. My friend noticed this after her fibro surgery. What did she notice? The pain or the endometriosis? So she needs to follow up with her doctor and make sure and see what's happening. All right. So another thing people have said, diet. They say if you change your diet and go for anti-inflammatory food that would not cause inflammation in the body, it can help regulate. I've not seen science that backs it up, but some people do it, and I'm not one to knock it. I'm the one to say, in conjunction with what your doctor tells you to do, please make sure you're doing other, you can do complementary studies. I'm not against complementary studies. So please make sure physical therapy exercises can help also, can help. All right. So let me see if I'm not leaving anything out. Ultrasound, MRI, laparoscopy, we talked about that. Pain medicine. Oh, some women can actually go on hormone therapy. Some women can go on hormone therapy. If you go see a gynecologist, they can place you on hormone therapy. That may help. It may not cure, but it will help. All right. Yep. And some women, if it's so bad that they cannot handle the pain or they're done having children and they're like, I don't want to go through this. They may have oophorectomy, hysterectomy. They might have the ovaries taken out. They might have the uterus taken out. If it's in the uterus, like if it's in that area. So you can go in and have surgery. All right. Like I said, infertility endometriosis may cause infertility. So make sure you're following up with appropriate doctor. And I think basically that's about it. What can you do at home? Pain management, take warm baths. It's very, very painful. She's taking it to stop like 2 months, avoid pain. It's horrible. Yeah, Miss Florida. I'm told it's terrible. I feel bad for those women. I am told it's terrible. So, God bless them. God be with them. God guide them because I don't know what else to tell them. I know. So, and I think that is the end of this. Do we have any questions that I may help you answer before I leave? Because I'm trying to be cognizant of your time and not waste your time. And not waste your data because I appreciate you guys watching me all the way from Nigeria. I appreciate everybody watching this video. Please ask questions if you have any. Send me an inbox if you're shy to ask over here. I'm here every Sunday, 6 p.m. Nigerian time, 12 noon. So you said the total. Okay. I'm crossing my fingers also for your daughter, Miss Joyful Noise. I'm crossing my fingers for her. Either that or she's just used to the pain. So that may be the issue. That may be what's going on. So I'm here every Sunday at 6 p.m. Nigerian time, 12 noon Texas time. And please figure out your time zone from there. Yeah. Okay, so if she's having pain outside of period days, that is something else. Endometriosis normally occurs around your period. It shouldn't be occurring when you don't have your period. What can be done to prevent it? Nothing. Nothing. There's nothing. We don't know what causes it. If there's nothing, if you don't know what causes something, how can you find out what you can do to prevent it? Nothing, Ms. Rashida. There's nothing we can do to prevent it. It's your body. It is your body. Alrighty. So it is a pleasure to be here today. I will be back next week. Thank you for watching me. Thank you for, being here. Don't forget to please share this video. All I ask, how you encourage me is by sharing this video, liking it, sharing with your friends, tag your friends, invite your friends to join us on Health Talk. And Dr. Sunshine signing off. Take care of your body. Take care of yourself.